If your blood pressure reading suddenly shows 180 over 110, is that something you can wait on? Or is it an emergency? Many people check their blood pressure at home and aren't sure when a number is just high, or when it could be dangerous. In this video, we'll break down what blood pressure readings are considered dangerous, when to take them seriously, and what you should do if you see a very high number. Welcome to Your Health Numbers, where we explain important health numbers in simple, easy-to-understand terms. Let's do a quick recap and briefly state what blood pressure numbers mean. Blood pressure is written as two numbers, like 120 over 80. The top number measures the pressure when your heart pumps. The bottom number measures the pressure when your heart relaxes between beats. Most people know that numbers above 130 over 80 are considered high. But not all high readings are equally dangerous. So, what blood pressure is considered dangerous? A blood pressure reading becomes dangerous when it reaches very high levels, typically around 180 over 120 or higher. This is known as a hypertensive crisis. At this level, the pressure inside your blood vessels is extremely high and can start to damage important organs like the heart, brain, and kidneys. A hypertensive crisis doesn't always feel dramatic, but it can be serious. There are two types. 1. Hypertensive urgency. This is when blood pressure is very high, around 180 over 120 or higher, but without severe symptoms. 2. Hypertensive emergency. This is when blood pressure is very high and there are symptoms suggesting organ damage. This is a medical emergency. If blood pressure is dangerously high, symptoms may include severe headache, chest pain, shortness of breath, dizziness or confusion, vision changes. One important thing to remember is you can have dangerously high blood pressure and feel completely fine. That's why numbers matter. When to seek immediate medical attention. If your blood pressure is 180 over 120 or higher, here's what to do. First, wait a few minutes and check it again to confirm the reading. If it is still very high, seek medical attention right away, especially if you have symptoms. This could mean calling emergency services, going to the nearest emergency department. This is not something to ignore or wait days to recheck. If you get a high reading at home, 1. Sit down and rest for a few minutes. 2. Make sure you're calm and relaxed. 3. Recheck your blood pressure. Sometimes readings can be temporarily elevated due to stress, anxiety, caffeine, recent activity. But if the number stays high, it needs to be taken seriously. In pharmacy practice, we often see patients who feel completely fine but have very high blood pressure readings. This is why regular monitoring is so important, because high blood pressure doesn't always cause obvious symptoms until it becomes serious. Over time, consistently high blood pressure can increase the risk of heart disease, stroke, kidney problems. That's why managing blood pressure through lifestyle habits and, when needed, medication is important. A dangerous blood pressure reading is typically around 180 over 120 or higher. Even if you feel fine, numbers in this range should never be ignored. If you see a reading that high, recheck it. And if it remains elevated or you have symptoms, seek medical attention immediately. Understanding your blood pressure numbers can help you recognize when something needs urgent attention. If you found this helpful, consider subscribing to Your Health Numbers for simple breakdowns of the health numbers that matter most.